The next question, Josh, is for you. And it has to do with surgery specifically, because oftentimes, so there's this differentiator between going into like a medical specialty or a surgical specialty. If someone's watching right now and they're interested in being a surgeon, right? If they're interested in doing what you do, what advice would you give for them about deciding on the field and about sort of what they should be thinking about between now and the stage that you're at for becoming a surgeon?
I think if you're coming at it and you're in an undergraduate, then you have a lot of time. And chances are you're going to change your mind a lot during the medical school process. I know that I came into medical school wanting to go into a different specialty. And then even during my third year, which is typically when people decide and apply into the specialties ultimately that they're going to be in, I changed. And you see, even in general surgery, for example, 20% of applicants ultimately leave after their first year of residency to go to another specialty, whether it be anesthesia or something else within medicine. So you have time. And if you're interested in surgery, then good for you, and do your homework and pursue that specialty, get connected with surgeons, do clinical experiences if you're interested in research projects, because that's a good way of getting connected with surgeons, then for sure do that. But if you ultimately ask yourself, am I willing to make the sacrifice to my time and training years to do this? And your answer is no, then that's okay. Even if you've spent years wanting to do that specialty, you can go into something else. Nobody's going to judge you for it. People have those types of conversations with themselves. So I would say if you're interested in surgery at this point in your careers, keep on pursuing it. Once you get into medical school, then you can start really pursuing those clinical experiences more and becoming more familiar with what it takes to become a surgeon. And then it's ultimately a personal decision with whether or not you want to continue with it. And there's no pressure one way or the other.
Absolutely. Absolutely. Definitely. Yeah. And there is time to change and decide, and that process, that's an evolving process until you go to residency. And even after residency, some people, like you said, change their career decisions. And the next question I have then is for Dan. If you could go back and do this whole process over, is there anything that you feel like you would have done differently? Anything that you would have changed about your application or your time in medical school or your time in residency? Was there a mistake that you made, or was there something that you feel like you would have wanted to go back and redo? Or do you like kind of how you did everything?
Yeah, I think first of all, just rounding out the last question, one of the people that graduated 3 years ahead of me in residency, he's now one of my attendings. He was a psychiatrist for 20 years before going back to do EM residency. So just to accentuate the point that you can choose your specialty, and if it's not for you, you can change it anytime. You can even do your specialty for 20 years and then decide that something that is different appeals to you more. But to answer your question, I would say in general, no. However, I would say the one big thing that I would have done differently is taken earlier advantage of all of the various support structures that exist for academic performance. As Josh can attest to, because we were roommates for a little bit, I am not a very good test taker, and I get a lot of anxiety related to tests. So at our medical school, we had a fabulous I honestly can't remember the name of it right now, of course, but it was basically like a way to receive counseling from people who were trained educational psychologists about how to go through the process of taking exams. And that was very, very helpful, but I kind of went into it a little late. I wish I had gone into it a little earlier and used that to my advantage for the very important step exams. Of course, it didn't really hinder my career prospects all that much at all, to be honest. And I kind of knew that I always wanted to do emergency medicine when I entered medical school, and emergency medicine it's not an uncompetitive specialty, but it's certainly not one of the more competitive ones. So it's not like I needed to get to do fabulously well, because I knew what I could do and I knew what I couldn't do so in terms of exams. And so I was very honest with myself. But that being said, I still think that I could have done more with exam prep, and I wish I had taken advantage of all the support structures that were certainly in my med school. And I hope for all of you who are here who will eventually end up in medical school, I hope will be at your med school too.
Great answer. And we're just going to keep moving through questions just so we try to get through as many as possible. I really appreciate you all writing in the Q&A and answering questions as we go. And again, whatever we don't get to, we're going to try to get through afterwards and send you via email. A physician will review your questions, so that we will have. But while we're on today, Melina, question for you about sort of something that the deans that we had on a panel earlier in the day really emphasized too, is that they look at applicants holistically, but there are still minimum criteria where it's important to still show that you can be academically successful with an MCAT score and a GPA. And for somebody who's applying who, say maybe finishing up high school or early college right now and interested in becoming a physician and going to medical school in a few years, what advice do you have for somebody to make sure, their GPA is as good as it can be, and that their MCAT is kind of at a threshold where medical schools will take a look and look beyond anything like that too? What GPA and MCAT advice would you say you have?
Well, to this day, I still think that the MCAT was the hardest test I've ever taken. I think that the step exams were really hard, but I felt like the more I studied, I could see some of that reward come back in my scores. With the MCAT, I felt like I could study like an extra 12 days and I didn't get a single point out of it. So I will attest to the fact that that was really hard. That was a really hard test. So it's not easy, but I think that if your GPA is not where you want it to be coming out of college, there are some programs that you can do if you're willing to take an extra year, like post-bacs or certain masters of science, for example, that are associated with medical schools that can boost your science GPA especially. So for example, I went to Tulane for med school and they have a master of anatomy, a science of anatomy there, where you do a whole year course in master in anatomy, and then you actually are the anatomy TA for the medical students. And because of that experience, they definitely had a leg up even in the Tulane medical school application process, because all the professors knew them, they knew the current med students. And so experiences like that are kind of like a double whammy, where you can get a better GPA and also expose yourself to medical schools and get your name out there. So I think that's one way to look at it. And then even things like Med School Coach, and there are some online free resources that people do even on social media. Those are things to take advantage of in order to get some better test taking skills.
No, that makes sense. That's really helpful. And the importance of the MCAT and GPA really can't be understated, because right, like schools, like we heard, really just want to make sure that you're going to be able to pass the test. In medical school, like we've been hearing all day, it's rigorous. So you don't need to have obviously a 4.0 and like a 5.28 on the MCAT, but it's still important to have those that show that ability to do well in school. The fact that you work hard, the fact that you can pass exams is just important. And then everything else beyond that is what we're also talking about. So Josh, I have a question for you as well. And it's also about the sort of leadership experience that it takes at every step of the game, right? Whether you're pre-med or you're in medical school, you want to show that you have those qualities and characteristics that will make you a good leader, because ultimately the physician is the leader of the healthcare team. So what are some ways that you think that pre-meds can show how they have those qualities and characteristics of being a good leader within medicine?
That's a great question. And like we're answering in the Q&A here, is leadership has come up a number of times. And like you mentioned, the physician is often one of the leaders or the leader in the healthcare environment when you're in the operating room. So you need to know how to lead a crowd and get people to want to unite under a common goal. And when you're considering where to find leadership experiences, they're often all around either your local community or within your college or university. So there are dedicated leadership type organizations that really try to foster leadership skills and public speaking, for example. There's something called Toastmasters, where you can really get a lot of practice public speaking. And then if you're interested in one of your own clubs where you have a group of people, it doesn't have to be anything large. If you're the president of your chess club or video game club, that's still leadership experience. You become more familiar with the different facets of what it takes to run a healthy and successful organization. And then if you're really into it in the idea of putting forth policy changes, then you can get involved with your local student government or community type governments. Some people look to Greek life as an opportunity for leadership experiences. And so those organizations are all there. It just depends on how much you're willing to put in the work to go from not just supporting yourself, but to supporting a whole group of people.
That's a great answer too. And it really doesn't even have to be a formal leadership position. It's just the ability to show that, hey, I'm able to guide a group of people under that in like common goal, like you were mentioning. It's so important to show.